Hi, I'm Kelly Mari. I interviewed Caitlin Wankowski today. Caitlin is a medical social worker at Matsu Regional Medical Center. Caitlin's specialty before becoming a medical social worker was working in the nonprofit sector. She worked with individuals in need of crisis intervention and she focused on trauma therapy. She's proficient in trust-based relational intervention, dialectical behavior therapy, and eye movement desensitization and reprocessing, EMDR. Caitlin's worked with those who've experienced eating disorders, and she's worked with sex trafficking victims. All of these things, all this experience has helped Caitlin with her daily role as a medical social worker. I asked Caitlin what she liked best about being a medical social worker. Caitlin loves to be busy, and so she said her daily schedule is it changes all the time. It's never the same. She gets pulled from one thing to another. There's crises, there's just standard things, there's the mundane task. All of those would be the daily duties of a medical social worker. She says what she likes best about being a medical social worker is being able to assist individuals who are experiencing community or social deficits by brokering or coordinating services to connect them with community partners. She also likes the fact that the pay is higher for medical social workers than it is for those who work in the nonprofit sector. I asked Caitlin, what is your least favorite duty? And she says doing applications for long-term care for the elderly or medically complicated patients. It's not that she doesn't like to do the work, she said, but it's a really long process and it can be really frustrating if the funds are not there. The general relief funds, things that, the funding that as social workers will be dealing with can sometimes be cut because of budgets, or they've lost a grant or some other thing, and then that causes the patient to maybe have to stay in the hospital a little bit longer, even though they're medically able. They're not really medically needed to stay in the hospital, but they don't have the good resources at home, and so that's the safest place for them. That can make everybody a little upset and frustrated. It can make the nurses and the doctors frustrated because they need the beds, but then the social worker is saying, hey, I can't send this person home. She has nobody to take care of her, the house is unsafe or whatever. So that can be difficult. And I can understand why that would be one of her least favorite duties. I asked her what the hardest things she's had to deal with so far as a medical social worker. And she said recently she had a homeless man come in and he didn't even know he was that sick, but he was given a terminal diagnosis. And so she sat with him and she helped him process that. And she said sometimes it's difficult to remain empathetic and show compassion while you're just dealing with the ugly part of you're going to die soon. And it's that fine balance, and that can be another typical day, is just dealing with somebody who's had just a great traumatic statement said to them, you're going to die in the next 6 months, or your child just died, or you have cancer, or anything like that can make it really difficult. Another part of her job that can be difficult, she said, is responding to the codes that can happen all day long, including those that have to do with infants, like maybe infant death. And that can be very traumatizing for social workers and all medical staff. She said discharge planning is what she does the most of. She said it's one of the main duties, but again, it's often interrupted during a crisis situation or patient requesting something. And so discharge planning can just go on and on forever. It seems like in the life of a medical social worker day by day. I asked Caitlin how Matsu Regional Medical Center is working with the community to get a handle on the drug epidemic. We have some great resources here in the Valley. We have the Opioid Task Force, we have the Thrive Coalition, we have community members, we have a great band of service providers that work with people who are suffering from addiction. We have good peer support, but we also need our hospital to work with them. And I know personally from my experience working on the Opioid Task Force board that Matsu Regional is committed to helping those in recovery. And Caitlin said that she has seen the same thing. Since she's moved back to Alaska in 2018, she regularly sees those peer support services by True North, CITC, and Connect House at the hospital. And she regularly refers patients to drug programs in the state. And she also helps get them into detox. But we all know that the detox beds are few and far between. It's hard to find. She also works with Matsu Health Services. They do emergency mental health assessments on patients too. So they will do those after hours or on the weekends. There are also 2 behavioral health master level social workers, licensed clinical social workers in the new behavioral health unit that can do those crisis mental health assessments as well. Caitlin says that social workers get along with the physicians and nurses very well at Matsu Regional. She said there are times when they disagree on whether or not a patient should release. There was recently a disagreement over OCS being called. The physician was very much wanting OCS to take a more proactive role, where the social worker was less inclined, reported it. The OCS screened it down, and they were going to just check on the mom and baby after they were released. But the doctor insisted on calling back himself and got it moved up to a higher priority. And so OCS stepped in differently. And as a social worker, Caitlin said, she has no problem with that. But the biggest thing she wanted to remind me and everybody else who might go into medical social work is to always follow and maintain the ethical standards in the NASW. She said it's important to not cross boundaries and to just maintain those ethical standards at all times. I asked Caitlin, are you busy? And she said they're so busy, they just run their entire shift. They take turns, like one will do the first and the third floor, and the other one, because there's usually 2 social workers on at the same time, the other one will take floor 2, which is the labor and delivery floor. And they help each other out, and they work well together. But charting, as I said before, it takes place after each visit with a family member or a patient that has to do with the patient. It often gets interrupted. Codes are going off. Social worker needs to go somewhere else. They've got an on-call phone, so if they take it on their break, they're answering calls on their break too. So they just really never get a moment because they are just incredibly busy. Caitlin says there's definitely a need for more social workers. The more medical providers that we're getting in the Matsu Valley, the more need there will be for social workers to help close the gap and improve the continuity of care. Social workers are great for advocating for services that address the needs of each individual, and it's a vital role, and it all goes together in that medical social work model. And Caitlin's enthusiasm for medical social work really gave me hope that someday maybe that's something that I can do too. And it sounds exciting, never boring, and extremely busy, and something new every day. You just never really know what you're going to get into. So that is it, and thank you for joining my presentation.